Now, this is a follow-up testimonial. Your surgery was just 2.5 weeks ago,
Yep.
and we did a L5S1 fusion. Here's your picture where we did the bottom disc. We replaced it with a spacer. We opened up the hole where the nerves are passing through, and these are the screws. We stabilize your spine, and we did it with we did it with Oluf technique
Right.
just 2.5 weeks ago. And I'm mostly as well interested, your experience so early after the surgery, because just in the next room, I just saw, and I have a testimonial that I'm going to put online, of somebody who got an open old-fashioned surgery, where the surgery was 6 hours. She stayed in the hospital 7 to 10 days, she's telling me, and it took her even 6 months before she could do basic activities. And that was many years ago, but she just was offered exactly the same surgery for the next level above, because they took so much bone off, and that sort of weakens the spine. So the next level gives out, and she was told that you are going to have more surgeries. And yes, she's there, the spine is weaker, and she went through a horrible experience with that surgery. Now, first of all, when was your surgery?
2.5 weeks ago.
2.5 weeks ago. Now, you had leg pain for years before the surgery, correct?
Oh, yes.
So how is that leg pain right now?
It's good.
That's gone?
Yeah, it's
Okay.
fine.
When did the leg pain go away?
Right after the surgery.
Right after the surgery. How long after the surgery did you walk?
Well, I think I got up to the room like about 4 or 5, and I think
Your surgery was in the afternoon, right?
Yep.
Yeah. So you got to your room, and did you walk same day?
yeah, oh yeah.
Okay. And
And then the next morning,
next morning, and when did you go home?
that next morning,
Next morning. And you told me as well something that really made me happy as a surgeon. The next day, I got a testimonial. You remember what you told me?
Yep.
What did you tell me?
I told you it's the first time I could lay on my back in the last 4 years.
Yeah. Well, and how are you now? 2.5 weeks after the surgery, how do you feel? How
I
is it?
feel really good.
Okay.
Really good.
And the leg pain is completely gone,
Yep.
and the back pain is getting better.
Yep. All I can
Okay.
feel is like where you went in, and that's
And I
it.
did the surgery. Yeah, surgical pain, which is normal. Now, obviously, bone doesn't heal in 2.5 weeks.
Right.
You still have to, do some activities, do physical therapy, but hardware is in excellent position, and your symptoms are exactly as expected. That meaning, some still strange feeling in the where we did the surgery, but depending on kind of activities you do, you would be ready to start your basic previous life. Meaning, like obviously no climbing tree and so on, but do you feel you are ready to have the basic previous life?
Oh yes.
Yes, excellent. And then this is just 2.5 after the surgery, whereas in the next room, that lady needed 6 months before she could do anything. And that is the difference between us not destroying your spine versus open old-fashioned surgery destroying the spine.
Right.
Any question, any comment, anything you want to add?
Only comment I can say, I wish I would have found you before I had my first one.
Okay. Well, thank you so much for your interview.